Can you repeat? Oh, I'm documentary.
No, just to make sure I don't forget anything.
Oh, yeah, sure. So this one actually talks about the model number of your valve, right?
Oh.
So this is just temporary ID.
Oh.
And then they will send you a permanent one in the mail.
Okay. So when they look at me, which side of the valve I'm changing?
The valve is in your heart.
In here?
In your heart.
Yeah,
It's part of your heart.
Inside
Like
your...
right side or left side?
Which one is this? This is a mitral valve? What
Yeah.
kind of valve did you have?
The animal.
Mitral or aortic?
The tissue, I think tissue, right? That's how you
Yeah, but there
call
are
it.
4 different kinds of, there's several valves in the heart.
Yeah. I think I chose the animal one.
It doesn't matter which side it is.
Mm.
Mitral valve and tricuspid valve. So the right side.
In here?
The right side.
Yeah, he said one here, one here.
Yeah, one's the left, the tricuspid. No, the mitral
I
is
want
on
to
the
make sure I
left,
understand.
and the tricuspid is on the right.
Right.
Yes.
He replaced the Michael one?
I think he repaired your,
Yeah, that's
no, the mitral valve was replaced,
Okay.
and then the tricuspid valve was repaired.
repair.
Okay? All right. So basically, you also have prevention of infective endocarditis. So
What's that mean?
this means that when you go to the dentist,
Okay.
you need to let them know that you had a valve replacement because they need to give you antibiotics before any procedure because you're at risk for infection.
I know.
Okay?
Mm.
So you just keep this in your wallet, like, for,
I see,
for
okay. For going there, right? Going to the,
Exactly.
yeah.
okay, so you have several papers here. This is a TALAS. This is your copy. So basically, I put which one's your copy so you don't get confused. Okay? So we have a copy of this. So what it is that 3 business days from now and 7 business days from today, you will get a call from Heart Check. It's automated machine.
Okay.
They're gonna ask you a few questions about your incision, your sleep, your pain, or anything like that.
Okay.
And if your answers are worrisome, somebody will call you. Okay. If your answers are okay, then nobody is gonna call you. This is just a follow-up, and it's a machine asking you questions, and they're gonna call you on this number.
272-792. Okay.
Okay, and this is your prescription. Okay, this you will give to your pharmacy so they can fill it up.
Okay.
Okay, and the ones that you're getting are the ones in Circle Yes. For your warfarin, you're getting 3 milligrams tonight.
2 million.
Warfarin.
3.
3 million.
3. Yes.
Warfarin is the one thinner the blood.
The blood thinner. And then because of you're taking warfarin, you need to make sure your blood work is checked for your INR, and that would be tomorrow,
Oh,
July 18.
okay.
And then based on your INR tomorrow, the GP is going to dose your next one for your warfarin. If you're taking lower dose or higher dose or same dose.
Okay.
Yeah.
Okay? Because it's based on your INR.
Okay. That means iron.
Yeah, INR. How thin your blood is. Okay? This is for the lab, which you'll bring with them tomorrow. You bring and show it to them when you have your blood work drawn. And this is your final discharge summary. This is your copy. Your family physician will get a copy himself. Okay? So just tell us what kind of procedure you have done.
Okay.
They did to you, your warfarin, your medications, and I highlighted your follow-up appointment, okay?
Okay.
Make sure you make a follow-up appointment with Dr. Leong in 1 week.
Okay, that means next month.
Yeah, it could be earlier, as long as it's within the first week. Cardiologist, Mr. Wong, in 6 weeks. And your surgeon, Dr. Chang, after 3 months, only if there are concerns, because basically his care is done. So
Okay.
you don't need to contact him. You'll be closely working with your cardiologist and your GP.
Oh, so I won't receive.
Mm.
Yeah, so you don't need to call Dr. Chang if you don't have any concerns with your surgery.
Okay.
So that's your copy, and this is in connection to your prescription. This is your copy. So I made a medication profile. This is not a prescription. It's just a guide of medications that you're getting, the dose, how often, like you're taking at breakfast and bedtime, once a day, 4 times daily, and the reason why you're taking them.
Okay.
So it's just a good guide.
Good.
So what do I need to watch out?
This is just, make sure you, like I say, warfarin, you take it tonight at bedtime. And your Candisartan, you take it with breakfast. You know, things like that. So basically tonight, you're not going to get all the pills that you took this morning. Because it's only once a day. You're going to take your warfarin tonight. You're going to take your sleeping pill tonight.
Okay.
Yeah, and at 4 o'clock, you're going to take your spironolactone, which is your diuretic.
Yes.
What's that?
A diuretic is a water pill. Makes you pee
Oh.
to lower your blood pressure, so you don't retain fluid.
The fluid, huh?
Okay? Your ejection fraction is low. Your EF is 30%. So that's why you're monitoring your salt and you're monitoring your weight. They told me that they already did patient teaching to Auntie
Oh, yeah?
about heart failure.
Did you get it?
Like any
yesterday?
papers about like salt intake, you should avoid salt.
That is
Whenever you eat
in
salt-
Vancouver Hospital,
Hmm?
in Dr. Wong office.
Actually, we're trying to take out the salt for how many months already,
Not
right?
in St. Paul.
Okay, so then,
But we, the BGH,
okay, so they,
well, I realized that was the water.
no, they told me.
Even yeah,
they
keep away from that.
Where is it?
But you have one too. You still have one.
Okay, so I'm gonna give everything.
Okay.
Okay, so the prescription, don't forget, is here. Where are you gonna have it filled?
Superstore.
That superstore?
Yeah.
Okay.
So we'll get
This
it
is
there.
the one that you bring with you, okay?
So they won't take it out, right?
No, they will get the sheet from
Oh,
you.
they will?
So this is the prescription.
Oh,
And it will
but maybe
just be-
the whole copy or
This one you don't need to, because this is basically it.
the same thing.
Oh.
Yeah, I just transferred, because the rest of the medications are no. You're not getting them.
Okay.
Oh,
You know what I mean?
So we'll just bring this to the
Prescription. Yeah, I don't want you to get confused. You
Yeah.
know what I mean? Just
oh,
leave it in the
just
pharmacy.
keep a record picture.
So we will bring this to the pharmacy, right?
Pharmacy,
Okay.
they will keep it.
Oh, they will keep
Okay,
so that
yeah.
they have
Exactly. So they're just going to give you supply 3 out of 12. That means 3 months. out of-
3 months.
Okay? So basically, they're just going to give it to you now.
So
If-
how long I take the walk?
Mervin over here.
I think 3 months or something. Or that's
Okay, so-
Don't
kind of.
take a lifetime.
So the pharmacist talked to you already about
No,
warfarin teaching. I was told that they did teaching.
nothing.
Till you volunteered, didn't you?
Nothing.
Are you sure?
I am sure. Ask them.
No, pharmacist was here and talked to you about warfarin.
Yeah, that is.
Start?
Yeah,
When?
2 days ago.
Which lady?
The one who told you about
Blood thinner.
dark green vegetables and...
Yeah, stay away from.
Oh, you mean what's her name? The daughter of
You mean Joan?
Joan?
No,
Not
not
Joan.
John. It's a pharmacist.
Oh, pharmacy. Oh, I was not here.
What's not here?
No, I
She
mean.
did talk, because then she came and talked to Tom.
Oh.
Heard her talk to you.
Because you were showing me the piece of paper about
Yeah.
I don't have that paper.
Yeah, but she talked to you and gave it to you. I don't know what you did with it.
Really? Oh my God.
But is there any way we could get it?
Get another copy.
Oh, some.
No, it's usually the pharmacist would actually talk to you about it because they have a detailed stock. It's the weekend, so we don't have pharmacist.
Oh.
Mm.
So basically,
Mail me a copy or...
I don't know what they're handing out though.
Oh.
For
Because
pharmacists.
I was talking to them, they have something about the
Warfarin.
and then some, I don't drink green tea.
Green
And
tea?
green leafy vegetables. So now you remember. So they didn't
No,
teach
she
you.
teach me. She was the one give me my paper.
Okay, I'm just gonna check if
Who's older, huh? Maybe she's younger than you.
You weren't paying attention.
Yeah.
Oh, we see?
No.
She's younger than you, huh? I guess.
I think we call that part honesty. That's, remember you were showing me the paper, don't drink
Yeah.
green tea?
Yeah, well, I was
How come I
listening.
don't have it?
We were listening to when she was talking to you. And then she came over and talked to us.
Really? How does she know?